Thank you very much. We are going to open up for public comment, but before we do that, we are going to go back and lift the call on a couple of votes. So while people are getting in line for public comment, we're going to go back to the votes that we put on call. And the first, do you want me to wait? The first vote is item 1 under the Department of Healthcare Services ACA Medi-Cal Renewal Assistance Grant from the California Endowment. The current vote stands at 2 ayes and 1 no. So that bill is out with 2 ayes and 1 no. The next vote is merging the California Institute for Mental Health and Alcohol and Drug Policy Institutes. The vote currently stands at 2 ayes. Okay, it'll be 2 ayes and 1 abstention. And that's it for that calendar. Thank you very much. And before we go to public comment, Department of Finance also has a comment. Thank you.
Thank you, Madam Chair, members of the committee. Scott August with the Department of Finance. Department of Finance is opposed to these proposals as well as the ones listed in Part 2 of the agenda, as they're not currently included in the administration's fiscal plan. Each of these proposals would have varied but significant impacts on the state's general fund. And in addition, nearly all of these general fund impacts would be on an ongoing basis. For these reasons, the Department of Finance is opposed. Thank you.
Okay, thank you very much. And we have a question from Senator Monning.
Yes, thank you, Madam Chair. And just before the public comment, I had a question for LAO on page 20 of the agenda, the Caregiver Resource Centers with a proposal of $2.9 million general fund. It says funding for CRCs was reduced by 74% in 2009. Do you happen to know what the level of funding was before that reduction?
I don't recall, Sean, what the level of funding was before the reduction. What I can tell you is that they do need a certain amount of funding in order to leverage federal funds the last time that I looked at their budget. Mm-hmm. And I could certainly go check and find that out for you.
Yeah, we may have it here also, and I was just kind of curious to compare the proposed amount to what it had been in the past. Looks like 8.4 million.
That sounds right.
That sounds right. So this proposed 2.9 doesn't restore it to the prior level, but it would qualify for capturing some federal money. Is that your understanding?
My understanding is that they do use the funds to draw down federal funding. And I don't know if by adding additional funds to it, you'd be able to draw down additional federal funding or not.
Thank you. Thank you, Madam Chair.
Thank you, Senator Monning. All right, thank you very much. Public comment, and if we can please stick to 2 minutes, we'd really appreciate that. Hello, welcome.
Hello, my name is Alice Washington, and I'm an associate at CIMH, and I'm also a board member of the California Association of Mental Health Care Run organization. We are here to strongly support the mental health peer respite initiative for the one-time budget general fund augmentation. We think that this proposal, peer respite proposal, will create employment opportunities for people with lived experience related to mental health. Peer respite will reduce personal and system costs, public safety burden, and other negative impacts like lack of housing, repeated hospitalization, incarceration, and homelessness. People with mental health conditions often experience difficulties and stress in the community, and peer respite can provide a safe place to help people get through those crisis periods. The evidence for the effectiveness of peer respite crisis is still being built. There was one randomized controls trial being conducted in Sacramento County, and I understand that that program is still going. And we just want to thank CMHDA for putting forth the proposal, because in times of crisis, people need places to go, and hospitalization is a higher cost service that we probably don't want to incur that cost. Thanks.
Thank you very much.
Sorry about that.
There you go.
There you go. Madam Chair and members, White Siam here on behalf of Health Access. We are here to ask for support for restoration of funding for several items here. First, the Black Infant Health Program. We believe it's critical. Funding is restoration for this. Additionally, expanded access to primary care. Critical to expand access to preventative health care for the medically underserved. Providers are compensated. Also, the Medi-Cal primary care rate bump is an item that we are very much in support of restoring. We believe access to a primary care physician is a critical also, the optional Medi-Cal benefits restoration is an item that we are very much supportive of, and we urge the committee to consider restoration of these benefits. Last but not least, probably our most our priority issue is the safety net services for remaining uninsured. The only population excluded, as you know, from eligibility for health care is the population. Everyone else is eligible for something. This population is eligible for restricted Medi-Cal, but not comprehensive. As you probably know, we are working with Senator Lara to address this issue. To really ensure that everyone without regard to status is covered. Thank you.
Thank you very much, and we're very sorry for the technical difficulties. We do have some new batteries coming that will help the situation. But in the meantime, if the first few of you would come up to the podium here, and then we can have people seated in these 4 chairs right here, and you go ahead and have a seat. We'll get this all down. We didn't have a dress rehearsal, but we'll get it. And another person can come up, yes, to the standing lectern here. So we will start in the order you were standing, which I don't know what it was, but I know you know. So.
Made it a little complicated. Sarah Dickey with the California Pan-Ethnic Health Network. Thanks for the opportunity. Just as a note of record, so people of color, communities of color are going to be the remaining uninsured, primarily remaining uninsured, and they also tend to be inflicted by higher rates of chronic disease and health disparities. So the programs that I'm going to emphasize today that we would like to see restored really go towards reducing some of those disparities and also covering the remaining uninsured. So first is the Black Infant Health Program. Black infant health mortality rates continue to be the highest after decades. However, this program has been very successful in terms of reducing those rates and providing needed services. The Early Mental Health Initiative Program was also a very successful program at helping to ensure that young children are able to get the mental health services that they need, and had success across all different race, income, socioeconomic status, etc. We also support the higher rates for the Medi-Cal providers, as well as the expanded access to primary care. That funding is really important to ensure that providers are there to provide those services, those much-needed services. School-based health centers, as well as school-based mental health centers, are alternative methods for providing the remaining uninsured, as well as students who may not have access in their local areas for coverage. We'd also support the Medi-Cal optional benefits, the restoration of the Medi-Cal optional benefits. And then last but not least, really important services, providing the funding the safety net for the remaining uninsured, the proposal that would cover, as was mentioned before, the undocumented population, which is the population that won't have any access to preventive services at all. Thank you very much.
Thank you very much.
Chair and members, Sean South on behalf of the California Primary Care Association. I first want to thank this committee for giving us the opportunity to talk about these vital programs that unfortunately were cut in the darkest days of our state, but we've come out of it, and it's good that we can talk about restorations finally. On our agenda, obviously, the Black Infant Health Program, I think you've heard a lot about it. I think it's a small amount of money. It's shown to be effective, and I think it's a good use of our taxpayer funds. We also strongly support the Expanded Access to Primary Care Program. Obviously, our health centers were the primary beneficiaries of the program and provided the care to those folks that have no other coverage option. So it's been difficult without it, and it would be helpful to have that funding restored. Also, on behalf of the Oral Health Access Council, I'd like to thank you for considering the dental disease program as well. Another program that unfortunately was not restored last year when we dealt with adult dental, but is something, again, that's a small amount of money, but has had a real impact on the communities that it serves. I also want to say that we would strongly support the primary care residency program. We struggle every year to get enough providers into our community clinics and health centers, and anything that can be done by this legislature to incentivize folks to get into primary care and provide for the communities most in need is would be vitally needed. And then I will just close by saying that we echo the statements about finding a way to make the ACA work for all Californians and find a way to fund coverage, not just care, but coverage for the undocumented. Thank you.
Thank you very much.
Good afternoon, Madam Chair, and thank you for this opportunity. My name is Dr. Olivia Kasiri. I'm the County Health Officer for Sacramento County, and also prior to that, I was Health Officer in El Dorado County. This experience gave me an opportunity to work in both a large county and a small county. I'm here to talk about the TB funding, because the way that we get funding now, it's based on the number of active cases. And this is just the tip of the iceberg because it does not account for a lot of the other stuff that we do, like investigation of contacts and also outbreak investigation. Just today, part of my staff is at a high school, conducting TB screening on 500 students. And in order to do that, we have had to pull staff from emergency preparedness, as well as the TB clinic, as well as communicable disease staff, and then as well as staff from the school. If I was doing the same kind of contact investigation in El Dorado County, I would have had even less services or fewer people to help me to conduct that contact investigation. So establishing the TB Trust Fund will allow for additional resources to be able to allow all the counties to prepare for the unpredictable and yet very resource-intensive activities like contact investigations, especially the large ones, and also outbreak investigations. Thank you.
Thank you very much.
Good morning. My name is Dr. Lynn Silver with
Please push the red button. Thank you.
Good morning. My name is Dr. Lynn Silver with the Public Health Institute, also former Sonoma County Health Officer, and I echo Olivia's concerns as well. We're all aware of the rapidly growing burden of diabetes and other chronic diseases affecting 14 million Californians and responsible for over 3/4 of our healthcare costs and largely preventable. The burden of chronic illness is too great, too painful, too unfairly distributed, and too expensive for the state to fail to act effectively to prevent. We know that key evidence-based interventions on healthy food, physical activity, friendly environments, tobacco control, and empowering people affected by these illnesses can create sustainable changes towards healthier and more just communities and diminish this burden. PHI and others have been working successfully across the state to implement these changes with limited private funding and federal resources, such as the Community Transformation Grant Program being eliminated from the federal budget recently. This creates a very serious situation of lack of ability to invest in prevention. The recent statewide conference on prevention for the 21st century, sponsored by CDPH, CCLHO, and CHIAC, called for the creation of a California Wellness Trust. I'm bringing that suggestion before you. We propose that California help stock its rainy day fund by investing in prevention, using a small part of its budgetary surplus to invest in evidence-based community prevention programs through the creation of a California Wellness Trust. Such investments have been estimated to save $4.80 for every dollar spent. Specifically, we would propose that $1 to $2 per capita annually be used to fund such a trust, modeled after the Minnesota State Health Improvement Program, which I just visited. That program, financed with a small percentage of the state's Healthcare Access Fund, focuses on preventing heart disease, diabetes, and cancer by creating healthier communities. Minnesota currently finances that at the level of $3 per capita per resident per annum. Finally, we urge that any consideration of new funding and investment of resources for public health should reflect that no one sector alone can address these challenges, should be tied to outcome measures, and promote partnerships between county health departments, nonprofits, and community-based organizations. Thank you for your attention.
Thank you very much.
Hello, Ann Donnelly with Project Inform and the California HIV Alliance, and we'd also like to thank the committee for considering these important reinvestment strategies. And the one we just heard was particularly interesting. I want to speak to some HIV and AIDS issues. As you know, California has reduced the general fund support for HIV programs by over $180 million in the last several years through cuts and also through savings in the AIDS drug assistance program. At the same time, although new infections have remained somewhat stable in California, where they are significantly increasing is in vulnerable populations, most especially young African American and Latino, gay, and bisexual men. So this is a really important time for reinvestments in these prevention strategies. The first thing I want to speak to is the AIDS drug assistance program. We would characterize this as modernizing the eligibility criteria, and we think it's really important currently. We would like to see, the program uses federally adjusted gross income. We would like to see it align with the other health programs by using MAGI. Second thing is currently it treats single people the same as those with dependents. So we feel this is equitability. The program should be treating, both programs should be treating families the same as it treats individuals. The second thing I wanted to speak to was the $2 million for the investment in 3 public health demonstration projects. The National HIV and AIDS Strategy recognizes the importance of evidence-based, innovative public health strategies to outreach to those who don't know their status, which remains at about 15 to 20% of folks living with HIV, and also to take charge of their health and to link to and retain their care, ultimately reducing new infections. Providers in California are actually doing some really innovative and interesting work in this area. These demonstration projects would support that work. They'd also allow for expansion and sharing of best practices, which we think is critically important to making a difference to individual and public health. Lastly, I wanted to speak to a proposal that was not brought forth by the California HIV Alliance, but it's a proposal for a $7 million general fund reinvestment. Thank you. In mid-sized and small counties in their public health infrastructure, and Project Inform supports this important reinvestment. Thank you very much.
Thank you very much.
Chair and members, Kathy Mossberg representing the San Francisco AIDS Foundation as well as the HIV and AIDS Alliance. We would certainly align ourselves with the comments of my colleague from Project Inform and just sort of amplify again, the proposal is not ours to get at those rural or those counties that lost all of their dollars when times were very lean, but we would certainly from San Francisco AIDS Foundation support that proposal. On top of what Ms. Donnelly noted, we would highlight the proposal in your document regarding $5 million for syringe exchange programs. These programs over the years have proven to be quite effective, certainly in the focused population we're dealing with, and because of the federal ban on dollars being used for those programs, it would be very helpful to have some state dollars put into that. So we urge your support. Thank you for your time.
Thank you very much.
Thank you, Madam Chair. Maureen O'Haron representing AIDS Project Los Angeles, and I'm the guinea pig for the new batteries.
So far, so good.
I'm here to not only echo what Ann and Kathy have just talked about, but to focus in on AIDS Project Los Angeles' support for the pre- and post-exposure prophylaxis education program. Pre- and post-exposure prophylaxis are proven HIV prevention interventions that use existing HIV/AIDS medications to block new infections. Studies show that these interventions can be up to 99% effective in preventing transmission of HIV to non-HIV positive individuals. And for an at-risk individual, pre-exposure prophylaxis offers the best chance we have since the start of the epidemic at reducing the number of new infections. And as Ann said, what we're seeing right now is a rise in new infections among young gay men in African American and Latino communities. But the community and provider understanding of this is very low. And so what we want is a community education program so that doctors and physicians and patients know that this is available, how to prescribe it, when to prescribe it, so that people will seek care and doctors will know how to provide the care. Thank you very much.
Thank you very much.
Hi, my name is Barbara Brigham. I'm from the Teenage Pregnancy and Parenting Program in San Francisco, and I'm here to talk about the Adolescent Family Life Program. Under the current funding level for the Adolescent Family Life Program, there are limited slots throughout the state and extremely limited infrastructure support at the local and county level for operating the program. Many expectant and parenting teens are not likely to be seen by AFLP given the drastic cuts to AFLP, all general fund, as well as the disproportionate cut of 25 to 40% of federal Title V since then. Our program has been cut twice. Without state general funds, the opportunity to draw down federal match through federal finance participation is a lost opportunity to supplement state support and thus serve more participants. Expanded Adolescent Family Life Plan case management will address the case management needs of parenting teens that are not able to be backfilled with the federally funded California Nurse Family Partnership. AFLP case management will meet the case management needs of expectant and parenting teens that cannot be met through the Department of Social Services Workforce Development Cal-Learn program. Expanding AFLP will increase the chance of identifying expectant and parenting teens out in the community and increase referrals to and from local schools who specifically serve this population. Likewise, expanding AFLP will increase the chance of identifying expectant teens out in the community and the schools to the Nurse Family Partnership, as well as Cal-Learn programs. I'm asking you to please consider to restore the AFLP funds to the State General Fund.
Thank you very much.
Hello, my name is Jeanette De Los Santos, and I'm a young parent of a 6-year-old daughter. I'm a peer educator for the Teenage Parenting Program that gets funding through the Adolescent Family and Life Program. When I came to the TAP 6 years ago, I was homeless, and I had no support from anybody. But their caseworkers helped me with referrals. They referred me to a shelter that was convenient for me and my husband. Helped me with parenting programs. I got into their GED class and entered their internship program, an intern in one of their child care programs. Later, I got hired as a peer educator. 5 months later, I was blessed with my home, with my permanent housing. I am very grateful for the case managers and staff at TAP. They are my family I don't have. Now I'm enrolled in City College, and I start in 2 weeks. I feel it's very important to keep this program so that younger generations could benefit like I did. This program will help them grow and be independent. Thank you very much.
Thank you very much.
Thank you, Madam Chair. My name is Dolphina Melbourne, and I'm a case manager with the Teenage Pregnancy and Parenting Program. I am also a former client of the Teenage Pregnancy and Parenting Program. I can attest to the fact that this program helped me to be a better parent for my 2 children that I had as a teenager. And now as a case manager, I'm able to nurture and educate current teen parents on the importance of attachment and bonding and early literacy and continuing their education so that they can climb out of poverty. A lot of our clients are coming from multiple generations of poverty and assistance from the state. And with our program, we're able to show them a better way. So I'm hoping that you will help to restore the funding so that we can continue to support some of California's most vulnerable population, teen parents. Thank you.
Thank you very much.
I'm a lot shorter, so. Hi, my name is Veronica Souza, and I am a family advocate at Brighter Beginnings in the Adolescent and Family Life Program. I briefly would like to note that AFLP has drastically changed the lives of pregnant and parenting teens in Alameda County for the better. I've only worked for Brighter Beginnings since March of 2014, and I can honestly tell you that my clients depend upon our organization and AFLP funding for many things, spanning from helping them with applications for Medi-Cal for a child with asthma to getting enrolled into school to create a more successful life for themselves. Without our aid and the community resources we connect them with, many teens would feel hopeless and stuck in their homes, many having dropped out of high school after giving birth and finding it difficult to get jobs as a young parent. Offering young parents the stability and consistency of support and motivation to move forward will help provide a happy, healthy livelihoods for them and their children. Funding for the AFLP program in California is essential to the everyday lives of our youth and to the future of our state as a whole. Right now, we have 4 former and current AFLP clients with me who are going to share their experiences. Thank you for your time.
Thank you very much.
Hi, my name is Leslie. I'm 18 years old. My daughter, Elenacy, is 18 months old. Being a teen mom is one of the hardest things you can ever be. You go from worries of school and what outfit you're going to wear tomorrow to worrying about school still, money, in my case, fighting for a life. My daughter was diagnosed with gastroschisis at 15 months gestation. This condition caused my daughter to be born at 35 weeks with her intestines out of her belly. After 1 surgery, 1 month, and 3 days in the hospital, she has been my motivation for 18 months alongside with the case managers at Brighter Beginnings. Throughout the struggles I have faced being a teen mom, Brighter Beginnings has helped me pull through, whether it be help with diapers, help getting information and resources, to emotional support. Brighter Beginnings has helped me have met so many great people and have been blessed with the help they have given me. All the services I have received under AFLP program helped me provide for my daughter. I feel other teen moms would benefit from the support and services they provide like I did. Please restore AFLP funds so another teen mom like me can receive the same support and help that I got.
Thank you very much.
Hi, my name is Alejandra Alvarado. I'm 18. I have a daughter named Giselle. She's 4, and I have a son named Angel. He's 3.
Good afternoon, committee. My name is Mary Chris Diaz. I'm 21 years old. I have a 3-year-old daughter named Eleni, and we live in Oakland. I've been involved in Brighter Beginnings, which is funded by the AFLP. And when I first found out about Brighter Beginnings was just hours after my daughter was born. I went to go see her in the nursery, and there was a Brighter Beginnings case manager in the nursery, and she sort of explained to me what the program was about. And so she thought that it would really benefit for me because at the time I was 17 and still a senior in high school. So I signed up. And so they immediately assigned me a case manager, and so she would do monthly visits at my home. And I found it really helpful because she would just, every time she would come visit, the first thing she would ask me was if I was physically and mentally okay, and make sure that I wasn't being abused or stressed or depressed or anything like that. And she was just always concerned about mine and my daughter's well-being. And she also encouraged me and motivated me to achieve my goals and finish high school, which I was able to finish with very high grades. She also opened the door to many programs like workshops, including Empowering Mothers, in which one of the main things that I learned was that car seats actually have an expiration date, and I had no idea, which I found it very important because my daughter had a hand-me-down car seat. And she also introduced me to the Alumni Leadership Academy, which we go to local high schools and we share our stories as teen parents with teenagers, and we also give them some sex ed and show them different ways of protecting themselves if they are sexually active. She also was able to, when I finally did move out of my parents' house, we were struggling a lot, my boyfriend and I, so whenever we needed help with like diapers or housing or anything like that, she made sure that she brought all the information that I might need in order to make the right choices. And so also it benefited because every time that we had the workshops, they had childcare for us, so we didn't have to worry about where we were going to leave our children with. And not only that, but since my daughter is really shy, I think that it really helped and benefited her.
2 minutes.
Because she got,
You can finish. 2 minutes.
She got more open with the children, and I think that's going to really benefit her when she begins Head Start in September. Thank you.
Thank you for sharing your story.
Hi, my name is Treviana. I'm 19 years old. I'm a teen parent. My son will be 2 on May 18th. His name is Zion. I am a single parent. I am a working mom, and I am a college student. I was really alone while pregnant with Zion and didn't have a lot of people to turn to. When my son was just a month old, I began participating in a weekly teen mom support group with Brighter Beginnings. This program is where I was provided a case manager under the AFLP program. Having no knowledge of what case management services were, it started to become something I looked forward to along with the group. I became eager to see my case manager a lot more because I felt there is someone else that supports and cares for me and my son. This case manager program supported me through high school, helped me when I needed help the most, which led me to graduate from high school, and I was never more excited to take a walk like the walk I took across the stage. She helped me with my scholarship applications, of which I was awarded all 4. My case manager also helped me enroll in college, which was scary and very hard for me at that time, seeing my son had just made a year and was such a handful. But she made sure I stuck with my goals. Not only was I uplifted and pertaining towards school, towards education, but in areas as far as me and my son's health, personal, and future relationships. My case manager helped me with filling out job applications, preparing for job interviews, and I'm happy to share I nailed it and I got the job. I feel that teen mothers often get the short end of the stick because of the choices we've made. This AFLP program changed my life from being a teenager with a child to being a teen parent, caring and raising her child. And the case managers AFLP provides is essential to pregnant and parenting teens. I've never had someone else who wasn't related to me actually take the time out to text me and see how my English test went. And if I got a bad grade, I would receive one of the most uplifting texts telling me that they would help me study for the next one and that they were proud of me for trying my best.
And we're over 2 minutes, so please conclude.
Okay. I appreciate this program and my case manager for showing me that teen moms can be successful, loving, and still powerful. Thank you for allowing me to share my story. I hope you restore funding for AFLP.
Thank you for sharing your successes.